Thanks very much for inviting me, Christos. It's been a pleasure to be here so far. I'm sorry I missed the earlier talks, but I can contact those authors later with my comments and questions. So this paper is going to be really similar in many ways to the paper that that Till and Ingvild just presented now. And so we've given it this grandiose title that I think is much broader than what we can actually deliver. But the question we're trying to go after is how should policy responses to this pandemic differ? And so I'm not going to spend a lot of time on this, since it was pretty much exactly what Till showed in his nice slide, except he had the actual picture and we're just saying things in words. One of the things I wanted to highlight relative to what Till said is he talked about how the blank downs were kind of equally severe or perhaps even more severe in Uganda. And I remember reading the BBC, interviews with people who said, we're hungry, we can't leave our house in Kampala. And so it's like, it hammers home, the economic consequences of keeping people home are high, particularly if you're not transferring the money. And so that's one of the big things we're going to emphasize here in this paper, that, that rich countries said unemployment insurance, direct cash transfers. Developing countries, there's been some transfers, but it's really hard given their limited fiscal capacity to actually send, very large transfers. So now that infections are rising rapidly, and that's kind of the limited ability to lock down is looming large, we're trying to think about ways we can guide policymakers possibly to take a different approach than the West. So what we're going to do is we're going to address this issue of what policy responses should look like in low-income countries in an incomplete markets model. So similar to the Eichenbaum et al. Paper that Till just described a few moments ago, but this is going to be a model where rather than just one household, there's a whole bunch of heterogeneous households that all look very different potentially in their infections, in their consumption, how much savings they have, how well insured they are, etc. And we're going to focus on 5 differences between rich and poor countries. So younger populations, that was in Till's paper. Less fiscal capacity, I wasn't completely clear whether that was something they had, but that's one that's going to loom large here. So this is going to be, it's just real hard to either tax or borrow to make payments to the populace. A large informal sector didn't seem to bear in their setup, and that's going to be a real important channel here. So this informal sector is going to be a sector where you're doing kind of unskilled tasks and you are not paying taxes and you're not participating in the lockdown. So whether they can lock down the informal sector, that's kind of varies from country to country, exactly what you're talking about. You may imagine that they can go to parts of the city that are, more informal production and make sure people aren't out on the streets. It's hard to go to every village and, regional town and do this. So we're going to just assume as a strong assumption, but maybe not unreasonable in the first pass, that the informal sector just can't enforce a lockdown at all. Less healthcare capacity, that's going to be just like in Till's paper. More hand-to-mouth households. So it's not exactly the same as the subsistence term that Till showed, but it's going to be similar. So there's just going to be less households who have these savings they can run down. And that seems to be something that's pretty characteristic of low-income countries. And so here's a preview of our results so far. This is like every COVID paper. This is a work in progress, and we seem to learn so much every week about this pandemic that you're constantly updating stuff. So far, we find very much what Till did, and I think it's not so surprising that blanket lockdowns don't actually work as well in low-income countries. So we're going to give a statistic which we think captures the bang for the buck, which is how many lives you save for every unit of GDP you lose. And we say by that metric, low-income countries, blanket lockdowns save about half as many lives per unit of GDP lost. Still, blanket lockdowns are better than the Bolsonaro Brazil approach, where you just let it rip and you just pretend nothing's happening. So in none of the scenarios that we simulated do we ever find that blanket lockdowns were literally worse. We were wondering whether we'd find that. No, they were always better than having no lockdown. Something that works even better than either of those is an age-dependent lockdown. And this is something that's been studied in the US. And basically we argue that you can, in terms of this lives saved per unit of GDP loss, you can do even better than in advanced economies. And the key idea there is that when you've got limited fiscal capacity, so you can't make transfers to 75% of the population, maybe you can make transfers to like 5% of the population. And if those 5% of the population are the old, which actually is more than enough to cover the 65 and older population, you can actually shield the people that are the most vulnerable, make transfers to them to encourage them to stay out of the workforce, and then keep the rest of the people earning their livelihoods. And so that's kind of in short why this works kind of even better on this lives saved per GDP unit kind of result in low income countries. There's 1,000 difficulties here. Implementing this is not easy. Implementing any lockdown is not easy. There's all sorts of implementation issues. This is a model that assumes basically that we can do this in the formal sector, but not at all in the informal sector. Whether you can enforce this, partially in the formal sector and partially in the informal sector, that would potentially change the results. We're working on that. Okay, so I'm going to just show one graph because I think this parallels a lot what's already been said. So these are the 5 things that basically in the model I'm going to show you in a few slides are going to differ across the countries. Or these are the 4 things. I don't have the hand to mouth. That's introspection suggests there's more hand to mouth people in Africa. I don't have data that I'm going to stick my neck out on yet. So here's hospital beds per 10,000 people. It's about 4 times as high on a per capita basis in advanced economies. This does not include, whether they have a ventilator and stuff. I'm sure if you threw in other things like ventilators, you'd see even a much more dramatic difference there. Fraction of the population that's older than age 65, that's the population that far and away is going to be the most likely to succumb to this illness. 15% in the advanced economies, which we're measuring here as the top quartile of the world income distribution, just 3% in the bottom quartile, so what we call the developing economies. Tax to GDP ratio as one simple measure of fiscal capacity, about twice as high in rich countries as in poor ones. And the share of the workforce that's self-employed, which it could be a proxy for the informal sector. It's not a perfect proxy. It's something that is less debatable, I think, than various measures of informality. And here you see a massive difference. It's much easier to go to a firm, everybody's recorded, lock them down than it is to lock many different family farms and small family businesses. So these are the differences we're going to highlight in the paper. So here's the model. I'm going to give, I noticed as I was looking at the program overview this morning, where the presentation is supposed to be non-technical. So this is my non-technical overview. Unfortunately, it's hard to present a model without any equations. So I'm going to show some equations on the following few slides, but here's the model just in a nutshell if you don't want to look at equations. So this is going to be a epidemiology model. Just like in TILS, we're going to have slightly different categories. We're going to have the S's are susceptible, the I's are infected, the C is critical, and that's the period here where if you don't get to the hospital, you're gonna die. And R is recovered. There's also dead. We're going to have age heterogeneity, as in this Glover et al. Paper. And so this is going to be there's going to be old people, there's going to be young people. That's just a label, basically. They're not young people. Never become old. It's in a pandemic, that the time is so fast. They're fixed types. And then there's a whole bunch of heterogeneous households who are bumping around in the model. And if you've seen like the Iagari model of incomplete markets, these are going to be close to the Iagari agents. So they're going to have income shocks. There's going to be good times. There's going to be bad times. And how do they insure themselves against the bad shocks? The answer is their own savings. That's it. And so in the US, maybe there's insurance policies and there's lines of credit and things like that. In most low-income countries, those things are minimal. There's also health risk. You can get sick, you can die, and you don't want that. And kind of the key thing here, like I said, is you accumulate assets endogenously. That's your one way of insuring yourself, and you face credit constraints, which prevent you from borrowing. The two sectors are the formal and the informal sector, as I mentioned before. The formal is kind of skilled production. So we're going to have this as a stand-in for something that you do once you have a secondary school education or a college education. And there's informal, which is unskilled production. This is, even if you've got a PhD and you're selling candy on the streets, you're probably just as good as anyone else selling candy on the streets. So this is like unrelated to skill. And then in this informal sector, there's no lockdown that applies to you. So you can keep spreading the germs and keep getting infected. But you don't pay taxes either, so you're mooching off the system. The government here is going to collect taxes and make transfers, but with limited fiscal capacity. So in lower income countries, it's going to be harder for them to do that. We're going to have an iceberg cost where if you collect $1, only say 50% actually gets back to the people. This related to a comment earlier that Christos made. This. It's a simple way of thinking about how money is just hard to collect and then spent unwisely once it's collected. So here's some equations. This is the preferences and the types of households. So there's measure omega of these young guys, measure 1 minus omega of the old, and the preferences of everybody that's alive. They have this discount factor beta JT. The J stands for either young or old. Basically, the old people are going to discount the future more than the young. And for anything other than a model of a pandemic, this is preposterous. You actually have to model young and old, but in a pandemic, I think this is probably about right, that you could just think about them as having a shorter horizon through their beta. They have log utility and consumption. There's not this subsistence term, but there is curvature still in this log term. And then if you're alive, you get this U bar. This is why you want to be alive. You like these U bars. If you die, you don't get the U bars anymore. And so part of this discussion about what's a life worth boils down in this model to how much are people willing to pay to keep alive so that they can get all these U bars. The agents are heterogeneous in their productivities. And so just like in the Roy model, the famous Roy model, everybody's born and they have a number Z stamped on their head. That's like whether they're educated or not. And that governs their productivity in the formal sector. One is their productivity in the informal sector, and it's anyone can supply 1 unit of labor and work in that informal sector. The formal sector productivity is drawn from some distribution G. And then there's going to be this temporary shock, V, which is going to be an AR1 process in logs. And this V thing is just going to multiply your productivity. So this is like, if you want to think about this as a health shock, some days you've got malaria, you're sick, you can't work. Other days you're feeling great. That would be literally what this is. I'm sure in reality there's much more going on in terms of what the shocks are, but this shock is common to the sectors. So the only thing that we can really say is it's like a health shock. And so you have this health shock, you have this permanent productivity, and you choose every period whether you want to work in the formal sector or the informal sector. Z only matters in the formal sector. So if you think about people with a PhD, they're never really going to have much of a choice. It's always way better for them in the formal sector. People who have a really low Z, they may go back and forth depending on whether there's a lockdown or not. Absent a lockdown, we've set this model up so that once people are in a sector, they always stay there. It's only the lockdown that's going to get them to switch sectors. What happens when there's oops, I missed this slide. There's health shocks. And so suppose you get infected. I'll talk more about infection in a minute. Suppose you get infected by this virus. You become less productive by some fraction eta until you're recovered. If you become critical, you just can't work at all. The critical would mean like you just can't get out of bed and you're on your deathbed. And so this is like your productivity zero, can't work at all. You lose this U bar thing if you die, like I mentioned before. So we're going to imagine the government has a technology to lock people down. And the way the lockdown works is there's kind of a double-edged sword. On the one hand, you reduce people's productivity, at least in the formal sector. So there's this lambda W, which is between 0 and 1, and it multiplies your productivity. So that's 50%. You're just 50% less productive in the formal sector. Your business is shut down. You have to do some, sales through your network or something. So why would you ever do that? The answer is because it reduces the risk of infection. By keeping people out of the workplace, they are less likely to spread the virus or be infected with the virus. And so that their probability of infection goes down by some other fraction, lambda H. And so a lower lambda W and a lower lambda H mean a stricter lockdown. In the limit of 0 and 0, you will not get infected at all, and you will not be productive at all at work. We're going to think about these not as choice variables, but as some kind of fixed parameter, which is just available. And the government has a light switch. Either I have the lockdown on or off. Of course, in reality, there's shades of gray, but we're gonna just assume that you either can lock down or not. Production in this economy is Cobb-Douglas. It's a Cobb-Douglas aggregate of a labor aggregate and capital. Capital is domestic capital, which is the savings of the workers, and foreign capital, which comes in at some exogenous world interest rate. And the labor aggregate, which this is taken from this Ulysses paper on informality, is an aggregate, a CES aggregate of the informal labor, which is just the number of bodies in the informal sector, and the formal labor, which is the total number of efficiency units in the formal sector. This A thing is the exogenous productivity of the formal sector. And so like in Till's talk, he was talking about, obviously there's these massive income differences. Uganda is much poorer than the United States. In our model, this A thing is what makes, Uganda separate from the United States, really. This A thing, if it's high, we're really good at using our formal labor and doing stuff. And if A is low, we're really unproductive and we can't. The A doesn't hit the LI over here, and that's kind of like motivated by the Caselli-Coleman and the Hannes-Malmberg and other evidence that skill-biased technological differences really apply across countries as opposed to some neutral technology where even taxi rides are just much better in the United States than Africa. I think that's hard to swallow. Much easier to swallow a world where countries are different how much they use skilled labor. So I'm going to go fast over here. Households save at a rate that's different than the world interest rate. It's even going to be negative in our model. So that households are going to save you. Think about you save some currency, and there's some inflation. It's inflated away. So this is a trick to get people to not hold a lot of assets in equilibrium. In the data, you go to a country like Uganda, you're not going to find that people have several years of cash sitting there. They have very little cash. This is a way of having them do that. Households basically have a consumption savings problem. So all their expenditure is either consumption or savings. They get income if they work in the informal sector, which is just the informal wage times this V shock, like how productive they are due to health. If they're in the formal sector, they pay taxes. They get their permanent Z times their V, their stochastic shock. They always get their savings back with some payments, and they get a transfer from the government. And this is not the kind of COVID transfer. You could think of this as the baseline saying there's going to be some extra transfer possibly that comes in due to COVID. This is how health states work. So if you're susceptible, which I just took a COVID test and I thought I had it like many people. Unfortunately, I didn't have it, so I'm still susceptible. And whether I'm in the formal or informal sector governs whether I become infected or not. In a lockdown, and not a lockdown, it doesn't matter. But when there's a lockdown, the formal guys are less likely to get infected. Now, if I become infected, whether I'm recovered or critical depends on whether I'm young or old. So the evidence suggests recovery rates are critically determined by young or old. If you had comorbidities in this model, which we don't, because we haven't added them yet, that would play a role here. If you're recovered, you're recovered, and you move on with your life. If you're critical, now this is the case where the healthcare capacity in the country really plays a role. So here, it depends not only on whether you're young or old, but this Greek letter theta, I'll tell you about that in the next slide, tells you how likely you are to be saved by the hospital versus, to not have any room at the hospital and you die outside the hospital or you die at home. So with any luck, you get recovered. If not, you die. And so this is how the epidemiology, if you will, works in this model. I think this is the last slide of math stuff that I have, and then we go to the exercises that we do. This theta thing I said is like the maximum intensive care capacity. And the idea is that if the number of critical people in the economy are below theta, then everybody gets a bed. You got 100 beds, 90 critical people, everybody gets a bed. But once this number of people that are critical is more than the number of beds, now everybody can't get a bed. So they're in the hallway, or they're just left outside, or they stay home. And what's the punishment? If you don't get a bed, we're going to scale up your probability of death by this factor kappa. And this is the formulation that Glover et al. Use, and they put in kappa of 2. Boy, I'd like to know what this kappa is. We have no idea. We go with 2 as well. But this is just like saying you're twice as likely to die if the healthcare sector is full. Somebody in the previous talk asked, well, what about other types of illnesses that you die from? We don't have that, but this in principle could govern that too. There could be some probability of a heart attack. And if you show up at a period where the hospital is completely full, you could die of a heart attack with much higher probability. We don't have that. We don't have that yet. Okay, so in the last, how much time do I have, Christos?
Well, a couple of minutes. Well, let's say 5, and then 5
more minutes.
Yeah.
Okay, so I'm not going to talk too much about how I pin every little parameter down, but let me just give you the big picture. So we solve for a stationary distribution of the model before the pandemic, and we calibrate 2 versions, one to an advanced economy, one to a developing economy. And what we do is we introduce the pandemic as an MIT shock. So that's like, if you've heard that word before, nobody had any idea this was actually coming. So that's, in this case, actually realistic. It's like the only time these MIT shocks have ever been realistic. But then you have perfect information about the pandemic since, including the perfect path of everything. So that's absurd. We're working on better informational models, and it's easier to describe them than it is to solve them. So this is some aspects of reality are here, nobody saw it coming, but imperfect information is not here. And then we're going to solve for the full transition path through the pandemic. I'm going to skip over a few slides now which show a bunch of parameters, but basically we're going to pull all the epidemiology stuff from that Ferguson paper back in March. And it seems that there's been there's some new evidence since then, but we were surprised at how even the more recent stuff in the Lancet really shows still the same basic patterns of death rates and stuff. Skip that. I mentioned the Ferguson stuff. One of the things I'll mention is that this behavior that we have here, absent the lockdown, is supposed to capture the behavior already of people adjusting their own behavior absent a lockdown. So we're not just going to assume the lockdown is the only way people curtail their activities. This is we're going to include the fact that, for example, people stop going to restaurants even before the lockdown. That's already incorporated in our no lockdown scenario. What differs between rich and poor countries? Rich countries are a lot richer. Okay, so that's a joke. They're a lot more productive. They have a much smaller informal sector as a result. We sidestepped this thing, Till and Ingvald, by just multiplying the average level of consumption by the same factor. So this is that scaling up the cost of life. transfers are going to be a lot bigger in the rich countries. So advanced economies are going to, this is about 1% of GDP, developing countries 0.1% of GDP. The differences in young and old, hospital beds that we talked about, that was just from the graph on the previous slide. So this is what the lockdowns look like in the advanced economies. I'm going to go fast here because our pictures look a lot like what Till showed. You can flatten the curve in rich countries, and in poor countries, I took a screenshot, but I was amazed at the similarities here. You can flatten things a little bit, but you really can't do all that much. So this is a really similar picture to the one that they showed. So we're torturing these models, and these models keep confessing it's real hard to do too much in poor countries in terms of flattening. Here's just some summary numbers about welfare, GDP, and fatalities due to the pandemic. It's all bad news. These are all negative numbers. So this minus 8.3 means that in an advanced economy with no lockdown, this is like cutting people's consumption by 8.3% forever. By doing a 28-week lockdown, it reduces it to only 5.5% of consumption. On the other hand, GDP falls now by 18%. So there's a pretty dramatic decline in economic activity to achieve this, but you go from, over 1% of people dying to like 0.7, 0.8% of people dying. Another, like that map you guys showed, Till, with the, Africa had the least potential for deaths. You see that over here in these fatalities. So without any lockdown, there's going to be far fewer people in the developing world that are going to die from this, basically due to the age structure, even factoring in the worst healthcare. A lockdown does reduce this. It reduces GDP by some lower amount. So GDP does not fall as dramatically. And I'll talk more about why that is in a second. And you can reduce the welfare costs of this pandemic by the lockdown. And it's not as much though as you can in the richer country. Let me just show you some graphs that start with an advanced economy. And what we're going to do here is we're going to add in all the different features that we have in the model to take us from an advanced economy to a developing economy. So this bar is right here. I guess I'm covering it up with my screen. This is fatalities per 1,000. So this is like in the advanced economy under a 28-week lockdown, 7.8 people die per 1,000. Once we add in an informal sector, that goes up. Why? Well, because the informal sector is not really obeying this, so there's more deaths. We throw in worse healthcare, goes up even more. And now you throw in the younger population, boy, that just does a lot to reduce this death rate. And so that's the single most important thing by far in reducing the death rates. And it kind of over compensates for all these other liabilities that low-income countries have. Here's the GDP effects in poor countries, in advanced economies. There's an 18% GDP loss. The main thing that reduces this for low-income countries is that informal sector. The informal sector is not going to comply with the lockdown, and so you get a much less dramatic GDP decline. All the rest of these things don't do too much. And the welfare costs, you can kind of see that they kind of mimic these things. So as you go to an informal sector, there's more deaths. And so things get worse. Things only get better in terms of welfare because of this younger population. So that fewer deaths is really the only thing that's got going, and it's really powerful in this model in terms of welfare cost. So let me conclude with these age-dependent policies. So we're gonna model this by just assuming you can keep the old out of the workplace. It's not that we require them and force them to in the model. In the model, we tell them to, but they can always say, screw it, I'm going to go into the informal sector. But we transfer them some money, which is going to make them less likely to go into the informal sector. So I'm just going to show you one table here. There's more rows and more nuance in the paper. This is the number of lives saved per 100,000 people for every GDP point that we lose. So this is the bang for buck measure that I talked about at the beginning. So in an advanced economy, you get about 20 lives saved for every GDP point lost per 100,000 people. With an age-dependent policy, you can get that up to 50. So this is much more effective at saving lives in an advanced economy. Developing economy, this is even more dramatic. A blanket lockdown works about half as well as it does in an advanced economy. Age-dependent lockdowns work 10 times as well in terms of this metric as the blanket lockdown. So this metric may be abstract. In the paper where we talk about a way where suppose you want to save the same number of lives, you can do that with a far lower reduction in GDP if you do age-dependent policies, locking down or shielding only the old. And kind of the reason, again, I mentioned this earlier, is that you've got only 8% of the people are old, and you've got very limited fiscal capacity. So you say, take limited ability to lock people down and send them money, plus this limited number of people who are really dramatically at risk. And that's why this is going to be so potent. The challenge here is that there's comorbidities, and we're working on comorbidities. I view the we could put anything we want in the model. The limitation, I think, so far is it's not totally clear which comorbidities are the most detrimental, and so we're working on that. So that's it. We think that blanket lockdowns are better than nothing in low-income countries, but not all that effective. We think this model so far provides a strong case, given the limited evidence, for shielding the old as a way to deal with the pandemic rather than blanket lockdowns. There's lots of caveats, and we definitely need better data. Future work, we're working on adding back in the children, which I deleted and didn't mention it, so hopefully I snuck it past you. But the children are important because there's intergenerational household structure issues, which are really important. Locking down the old may not be effective if the kids go out, get the virus, and bring it out and make the old people sick. So we're working on thinking about whether we should close schools, because that not only directly affects the kids, but it indirectly affects how well you're going to be able to lock down just the old. We don't have any results yet for that. We're still working on that. So thank you, and sorry I went a bit over.
Thank you, David. Again, another interesting presentation and a fascinating topic, I guess. A quick question for me, mostly clarifying. So I guess the transfer is what are these savings? People who died, get collected from the government and get passed on.
So the way we modeled the transfer, I went very quickly over that. So the transfer here is a borrowing from abroad. And so this is like, you borrow some money, you have to pay it back at the end of the pandemic. So at the end of the pandemic, we tax everybody more, and we use the proceeds from these bonds to hand people currency that goes right into their budget constraint. So that's how we modeled it. I didn't explain that well enough.
Okay, so the old guys, don't save anything. Is that the point?
So the old guys in our model, most people in our model have almost no savings. So I didn't talk about the hand-to-mouth stuff too much, just in the interest of time, but most agents in the model have almost no savings at all. So they're very, very vulnerable. Okay. And even any time away from work at all cuts into the ability to consume. Yeah.
Okay. And I guess social distancing, you can accommodate that, somehow, or you're doing that. That's
Say it again about social distancing.
Yes.
So the social distancing, I'd say I don't think we have a great model of that. We have, through these infection rates beta, we've already tried to incorporate the changes in behavior that occurred even absent the lockdown. And so you see, even before Ghana lockdown, you already see dramatic declines in the movement. I wouldn't say they're dramatic, but you see some decline. So we're not thinking about this as the only way you can get people to behave other than that. So the social distancing could partly be in there. It could partly not be in there. So I really don't think I think our model's a very crude way of thinking about that, about masks. All of these other things could affect infection rates in ways that we don't really have yet in the model, but we can add them. it's amazing how, you know, like a month ago when we wrote this paper, we thought there was like nothing about that. And now there's all sorts of stuff about how, you know, direct estimates of how masks help.
And the last one, I mean, I'm curious to know what exactly happens to the volatility of consumption. So how volatile consumption is across the...
So the transfers do a lot to make the volatility go down. And it's less about the volatility than it's just the sheer level of consumption drops way off. If somebody's in lockdown and they're not earning income, their consumption plummets. And that's one of the things that shows up in this welfare thing. These agents do not like to have periods with real low consumption. Somebody asked, maybe even you asked, do they literally die? No, they don't literally die, but households that have very low consumption, they really don't like that. And so their welfare costs of the lockdown are really, really high.
Yeah, thank you. Tilman, would you like to ask the question yourself, or you're unmuted? No, not yet.
No,
now you are. Now you are.
I was related maybe to your question about whether and maybe I missed it in your presentation, David, whether there are linkages between the informal and the formal sector. So whether the lockdown feeds through eventually.
There's no linkages at all. And I think that's important. I mean, I think one of the things that is really important is not locking down the agriculture sector. You know, so to the extent that the informal sector is, you know, the subsistence farming sector or even the small scale farming sector with some commercial aspects, you know, you'd never want to lock that down. We don't have any of that at all. So you could imagine the simplest way to do that would be to have a two good model where you need food and then, you know, you maybe need other things. We don't have that. You know, you could have other crucial inputs that pass their way through input-output networks that we don't have that. The two guys who are the most, you know, let's say gung-ho about that I know are David Bakai and Emmanuel Farhi. And they have this paper with Jim Stock about the US, about reopening scenarios. And they have like as rich a model of sector linkages as anyone is going to put in a model, given what we know right now. And they actually concluded that made very little difference in terms of the optimal policy. That may not be at all true in Uganda, where you have the food sector and there's other inputs for the food sector. So I don't know, but for the US, their conclusion was that that's not a first order thing. Yeah, that's not why we put it in. We put it in just out of expediency.
Right.
But that's a good comment.
I think there's maybe an interesting parallel in terms of also the age-targeted lockdowns that you mentioned, that if it is true, that I don't have good data on, but if it's true that more of the vulnerable live in rural areas in countries and the households are older, which is probably true, I would imagine, and healthcare is definitely worse in rural areas.
Yeah.
And that's sort of the places you want to protect from the virus, but it's also the places that you want to restrict least because they're poorer. So
yeah, I agree. The rural urban stuff, we thought about that and eventually gave up because there's all sorts of stuff. I mean, the other thing about urban rural is the migration stuff. And there's lots and lots of immigrants, migrants, I should say. You know, and then somebody also, I can't remember was your talk or the previous talk, you know, that every developing country is different. I mean, in South Asian countries, there's a lot of landless peasants, let's call them, who are migrant workers in cities. Cities get shut down. They have no place to go. Africa, it's not that there's none, of course there are, but I think there's a much deeper ties between rural villages and cities, and there's a lot less landless families. You know, that makes a big difference to what your outside options are. I mean, right now in Ghana, a country in Africa I know the best, most of the cases are in the big cities, Accra and Kumasi. Rural villages, you know, haven't had this reach them yet, and so one of the ways you can lock down the elderly is keep the elderly in the villages and just do whatever you can. If somebody needs to go sell their agriculture wares in the cities, send some young person, send a middleman, just keep the old people from migrating to cities. These are all important issues, and they're none of them are in our model. I'm not sure whether we'll get that into this model or a different one. Yeah, but thanks for the good comments.
Thank you. Another question coming from Adrienne. Do you account at all in your paper for multi-generational living circumstances? I imagine that keeping a 65-year-old at home is fine, but if they live with their children who continue working, It might not actually be well shielded.
Yeah, we don't have that at all, and that's a comment we keep getting, and it's a really good comment. So that's kind of the next item on our list. So right now we've got the young and the old. We're gonna make it the children, the young and the old. The children are not gonna consume. They're just gonna be these disease vectors who bump around and live with other people. So yeah, we don't have this yet, but it's super important, especially if you want to think about actually having a lockdown policy for the old. You can't ignore who they're living with. I have this graph that, you know, if I was more adroit with stuff, I'd find it. Give me 1 second and let me pull it off. That shows how crucial this is. This came up yesterday as we were talking about how to model this. So this is contact patterns at home across countries. Whoops, I'm not actually sharing my screen, am I?
No.
Let me just share it for 1 second, and then I'll show this graph today. So this is contact patterns at home, and this is from a paper it's an epidemiology paper. This is a matrix of what age you are. So this is 0 to 80 is what age you are, and the y-axis is who you deal with. And this country right here, this is Germany, this is Bolivia right here, and this is South Africa. And so if you're a young kid, let's look over here. You're living with people of all ages. You're living with these elderly. So here are the elderly over here in South Africa. They're living with the kids. And then you come over to these German elderly. Who are they living with? And the answer is, actually come over here. These elderly are just living by themselves, basically. So you see these really stark intergenerational differences that are going to suggest adding these in is going to give us another nuanced reason. You could easily get that opening schools in the US or Germany make a lot more sense than opening them in African countries because of this infection. You know, in the US, you keep the kids away from grandma. It's hard to keep the kids away from grandma if they're living with you. So that's another excellent comment.
Thank you. We need to stop here. I mean, there's another one from Tusha, but I'm going to pass it on to you, David.
Yeah. Okay.
Later on.
I
Okay,
see
thank
it.
you.
Yep.